Good afternoon. You might be surprised to hear about acupuncture at this high-tech symposium. Let's go ahead. Dry eye, became another global pandemic hidden below the COVID pandemic, which is so widely covered by media. And the increased incidence after cataract LASIK surgery was reported repeatedly. So why is that? We provide some answer a little later on. And why is it so critically important? Well, because some post-surgery unhappy patients can become a real nightmare despite perfect vision, correct? So, dry eyes, some patients are impossible to cure by conventional therapy even after some of our surgeries. And even these patients can be treated by intraorbital acupuncture with very high success rate. So I think that's worth to keep an eye on this method. Deep intraorbital acupuncture, how we call it, was developed by my wife Jana, who is sitting by me here. And we basically introduce one single acupuncture needle 4 centimeters long, so it's really deep, into the orbit, below the eyeball, just below the pupil, just above the lower orbital rim. Acupuncturists call this point ST1. The patient can be seated or lay down. It takes 2 minutes to leave the needle there. Because orbit is highly reactive, you take the needle out and that's it. You need to basically repeat that 10 times in weekly intervals. And it can be combined with individual acupuncture body points by experienced acupuncturists, but it can also be one single needle below the eye by ophthalmologists with proper training. Let's have a look at short video. We first clean the skin, which is part of the standard regime, and then you insert the needle. You just feel the orbital rim with another finger and you bend the needle and insert it all the way down. Once again, no anesthesia, you insert it all the way inside. The patient can, talk, and then after 2 minutes, you bend the needle, you get it out. That's it. 2 minutes, you leave it there. Meantime, you write your report, and that's it. Okay. So, what are the contraindications? Obviously, ocular or periocular infection, anticoagulation therapy, and, the fresh lower lid or orbital hematoma, which are very rare. And even with some of the hematoma, if they start to turn green, yellow, you can continue and the effect is even higher, believe it or not. This is an extreme case. I wanted to show that you can get a complication like that. You should get ready for that and your patients as well. We assessed this first group of patients on visual analog score of dry eye symptoms, which is a numerical scale 1 to 10. 10 is the worst. And this is a clinical rating scale of pain or disease control. And we have a group of 10 persistent dry eye patients after LASIK with visual analog score 8 to 10. The worst patients, we treated them with all conventional available methods. We couldn't help them. And we performed 10 acupuncture sessions in weekly intervals. 7 out of those 10 nightmare patients improved their visual analog scale below 5. That's 70% of patients. And 4 patients out of 10, absolutely no dry eye symptoms. Worst nightmare patients. Isn't that worth thinking about that? The mean number of eye lubricants lowered from average 5 to 2 daily. And complications, we had 3 suffocations and 1 eyelid hematoma out of 100 treatments. That's 10 patients by 10 times. So I think that's pretty acceptable. What about another group of such bad patients treated by trained acupuncturists? 22 resistant dry eye patients with failed conventional therapy. Again, nightmare patients. 19 patients out of them, 50% improvement, and 8 patients, absolutely no dry eye symptoms, VAS score 0. So nightmare patients you can convert into 0 dry eye, complaints. So how does it work? Here comes the hypothesis of my wife. Spasm of myofascial orbital cone is important part of dry eye pathophysiology. To my best knowledge, that has never been published and postulated. And after eye surgery in topical anesthesia, the cone spasm gets worse. Acupuncture needle releases that spasm, and that releases the cone spasm, decompresses lacrimal gland, and improves dry eye significantly. To confirm that, we went for autopsy to a university department. We placed the needle there, then we removed the orbital fat, and you see the inferior rectus and oblique muscles. I bet most of you haven't seen them for a long time, correct? And the oblique muscle is quite thick, and the needle passes right through it and relaxes the muscle and the cone around it. So our experience is that typically after 4 to 5 sessions in weekly intervals, the tissue resistance gets lower, and that's a time where you feel the needle insertion is easier, and that's a time when dry eye starts to improve. If we don't have that effect, the dry eye does not get better. This chart confirms that experience. So complications, 5%. I don't think that's too high, but you can get them, so be aware of them. So why often dry eye after LASIK or cataract surgery? Because we perform in topical anesthesia. And why not after pars plana vitrectomy? Because they do perform this more complex and longer procedure under general anesthesia or retrobulbar block, and they release the cone spasm. So to conclude, it is effective against dry eye, can improve most of the resistant post-surgery patients, and can be performed by trained ophthalmologists or acupuncturists. It's a relatively simple and short procedure, but it has to be repeated 10 times. And it's the most significant innovation in my practice over the last 5 years. The best tools against dry eye in my practice, autologous serum tear eye drops and deep orbital acupuncture. It is by far most important and by far most powerful. So to save your nightmare patients, you might consider to master intraorbital acupuncture. Thank you for your attention.
Thank you, and I'm here to answer your questions.
Yes, so now, Pavel, you have a longer follow-up from the last time we heard this in Florence. So after you said about 10 sessions are necessary to make them better, so then you stop, times goes, what happens? What happens in the long-term observation after this onset of 10 sessions?
So long-term observation, the effect is definitely long-term, but some of the patients do come back. Typically, they come back in a few months, and they require 1, 2, 3 sessions in weekly intervals. Then they might come back in half a year and 1 or 2 sessions. Some of them don't come never. And the effect is really prominent because, once again, I would like to emphasize we do not present here at this presentation the group of random dry eye patients. These all were the worst patients who failed to improve by all the conventional methods which were available to us. So really nightmare patients. And 22 nightmare patients, 8 of them converted to no dry eye symptoms. I think that's, that's something which is incomparable with anything else.
Hi, Paul. Nice technique. I saw this for the 3rd time, actually. It was fascinating. But did you have any complication of neurotropia or problems with sensation of the cornea after multiple injections? Because I imagine the long ciliary nerves may be slightly tampered with multiple injections in the orbit.
Well, the only complications which we noticed were that subconjunctival bleeding and lower lid bleeding. That's it. Nothing else than that. Of course, some of them, they do feel a discomfort while you insert the needle. Some of them might even feel something like that you touch the nerve, so the discomfort goes a little bit like radiates, which is quite rare. But again, it's a comfortable procedure. I do it on my patients while they are seated. I don't even lay them down.
Okay.
Pavel, I mean, I love these alternative medicine approaches, but they're always criticized of kind of being, a mixture between maybe effect versus, strong placebo effect. How do you differentiate whether this is a placebo effect that people just, subjectively recognize an improvement just by placebo versus an objective outcome improvement?
I think that's a question just on target, because there is very likely many colleagues out there who think the same way. Again, if the placebo itself is able to improve almost 90% of our nightmare patients, let's use it. I think a good doctor anyhow uses placebo effect, because if you talk to patient, if you encourage the patient, if you give the hope, that's always a placebo. But the placebo can also be measured, and there are published papers that if you talk good to the patient, if you caress the patient face, and if you say, well, it's going to be good, you can measure increased beta endorphin levels in the spinal liquor. But if you perform acupuncture, it's 10 times folds more. So that's a real effect. There are many published papers that around the inserted needle, there is a little inflammation, neurotransmitters, immunomodulators are released, and it really works. So once again, I think it's out of question that you can convert by placebo 90% patients who went through many different procedures, which also serve like a placebo, because you go, to the IPL, to many different procedures. That's also a placebo. They didn't improve, and now you have 90% success rate. No question. Would that make sense to you, Michael?
No, I'm with you. just trying to understand you in terms of you will get these questions and people will ask what.
Yeah, sure.
And other than subjective reporting.
Yeah, and the acupuncture also affects not only the local part of the body where you insert the needle, it also affects the central nerve. There are MRI and positron electron tomography studies showing the effect. Okay, we have another question here.
Well, congratulations which is such a great success in the difficult patient group. But my question will be the same. You are using only subjective criteria. It's almost like an anecdotal report. Do you have any real-time data?
Yeah, the reason we are working on that, the main reason is there is a lot of objective measurements of dry eye, correct?
Correct.
Very often, these do not coincide with the patient's subjective problems. Having said that, I see patients with quite bad objective measurements, say, I have no dry eye symptoms, whatever. Okay. On the other side, I see patients with quite complaining bad, and the objective measurements don't really, match that. And I believe if these patients objectively used on average 5 drops a day, now it's 2 drops a day, if they just say, I have bad problems, I cannot keep my eyes open, and now they improved, to present the extreme. My wife treated 3 patients with blepharospasm. That's when the patients closed their eye, that was after cataract surgery, they could not open the eyes up to 15 years. Totally, handicapped people. And that was caused by dry eye irritation, which we found out. 3 of those 3 patients got back their driving licenses. They are back in life. That's what counts to me.
Okay, anyway, congratulations, and don't shy away from these controversial topics.
We keep going on collecting the data, and I'm just, I was awaiting the skepticism. Next question.
Thank you for the interesting results and cooperation between Chinese and European medicine, I would say. And if a comment, isn't not the time to change the local anesthesia during the LASIK operation? You have 20% of patient who complains, you have 10% you mentioned that numbers. Aren't we doing something wrong?
That's a very good question. Should we change the topical anesthesia for cataract or LASIK surgery for something else? When I was resident, we did extra cup cataract surgery. We were cutting the eyes almost, 4 o'clock around. No dry eye complaints, just no dry eye. Today we do 2 millimeter incisions. We have 10, 20% dry eye. complaints and very, very bad problem. I think this theory might bring up a possible solution. And the second comment, you mentioned Chinese acupuncture. In fact, this is not Chinese acupuncture. This is medical acupuncture, which is totally or significantly different from the Chinese one, and it's backed up by the arguments, scientific arguments. It's being published. You find out on PubMed many publications about the results, which are in peer-reviewed journals. So this is not like a Chinese mystery. This is a tool in the hands of medical doctor who follows the protocols. So thank you so much. I would like to conclude this session with a few slides. This is the slide of my wife and myself in Florence at Piazza Michelangelo, where we had the dinner with ACOS 35 years ago, and when we went for a hitchhiking trip, and we sit to almost exactly the same place. It was raining that day, so we had to use an umbrella, which I don't think looks too bad on the picture. So we enjoyed the beautiful city after 35 years, and I'm happy to be together with her there. And if you like the presentations, I would encourage you to become an ACOS member, and you can find all these presentations recorded on ACOS webpage. There is a simple tutorial here. You log in. If you are a member, you just put in your credential, and then you go to meetings and coverage to the selected meeting, and you see all the presentations with the videos, and you can choose whichever you want, and then, click and listen and watch the presentation as many times as you would like. I would like to once again invite you to Prague ACOS meeting. Many thanks to all our presenters. I would like to really thank you for your contribution, for your outstanding presentations, innovations, for your discussion. Have a nice weekend, and thank you all for joining us today. Goodbye. Bye.
Thank you. Goodbye.